Ladies and gentlemen, it's a great honor to be here and to present some data regarding heart failure in Korea. First of all, I would like to thank the organizers of this meeting, and especially Professor Kazan. It's to make a wonderful congress. Over the next 15 to 20 minutes, I would like to introduce the growing burden of heart failure in Korea and the characteristics and etiology. Also, you can see the practice and treatment patterns for heart failure. And finally, I would briefly introduce the status of heart transplantation in my country and some innovative therapy using stem cells, which is the my institution. So let me start with the burden of heart failure. As you already mentioned, the heart failure is a global health problem. More than 50 million people have heart failure worldwide due to the aging population and increased prevalence of risk factors such as ischemic heart disease, diabetes, and obesity. Also, our treatment skill and therapeutic modality has improved, so many patients with cardiovascular disease survived from the initial event, especially acute myocardial infarction. Korea is one of the most fast moving aged society, So Korea, from the aging to aged society, it will took just 18 years, and from aged to super aged society, we expect 7 years. We are going to have more patients with aged population. And also we have increased the risk factor. This is the slide from the Korea Health Insurance Review Assessment Service. So that shows the acute myocardial infarction and ischemic heart disease cases are increasing in country recently. However, many cardiovascular disease patients has improved survival. So death from cardiovascular disease is declining since medical and surgical care for cardiovascular disease has been improved a lot. I'm not sure about the data is exact or not, but we expect the prevalence of heart failure in South Korea is rising, and approximately 30 million individuals, 300,000 individuals have heart failure in Korea. The prevalence is increasing year by year. And also another concern is the medical cost related to the treatment of heart failure. So medical cost of heart failure is increasing by 50% during the past 5 years. This is our Korean acute heart failure registry data shows the clinical outcomes of heart failure. So in hospital mortality rate was the 4.9%. Urgent heart transplantation rate was 1.3%. So that together almost 6.2% has in-hospital mortality, and the median hospital stay was 9 days. Also, we calculated average medical cost for single admission is about $9,000. Clinical outcomes of heart failure is also pretty bad. So post-discharge, short-term outcome is poor, and the readmission rate is high. So according to the Korean acute heart failure registry, after discharge, 90-day mortality is almost 5%, and also 90-day heart failure readmission rate is almost 14%. This is the long-term clinical outcomes of heart failure in South Korea. So this is another registry, Korea Heart Failure Investigator Registry, shows the 1-year mortality is 15%, 2-year 21%, 3-year mortality is 26%. But we expect the real mortality is a little bit higher than this data because recent survey done by our study group showed although this registry was almost more than 80% of patients has follow up to 3 years. Recent our survey showed that patients who lost to follow was found almost dead. So I think the clinical outcome is a little bit worse than this data. So what about the characteristics and etiologies of heart failure in South Korea? This is the Korean acute heart failure registry data compared to the Japan, USA, Europe, and Africa, Asian Pacific regions. According to the Western countries and Japan, so age was a little bit younger, and comorbidity, hypertension, and atrial fibrillation and chronic lung disease was a little bit less frequent. So de novo heart failure comprised 52%, and compared to the Japan, USA, and Europe, so systolic blood pressure was a little bit lower, 131. Etiology of heart failure was the most frequent etiology was the ischemic heart disease, followed by cardiomyopathy and valvular heart disease, 14%, 2%. Also, we have a significant portion of the tachycardia induced, especially atrial fibrillation. So ischemic etiology was 37%, but the pure hypertensive heart failure was pretty low, 4%. So I don't have any explanation for why hypertensive heart failure is so low, but during recent 5 to 10 years, the Korean status of hypertension control was significantly improved. So recently, control rate is almost 45% of the hypertension patients. So what about the current treatment patterns in heart failure? So most frequently prescribed medication was the angiotensin receptor blockers. But considering the ACE inhibitor and the angiotensin ARBs, 2/3 of patients has receiving the ACE inhibitor or ARBs. And the beta blocker was prescribed almost half of the patients. And aldosterone antagonist was frequently prescribed almost 45%. That's that's the data. ACE inhibitor or ARBs was prescribed in 2/3 of the patients. Aldosterone antagonist was, I think it's frequently higher than the United States data, 45%, and beta blocker was a little bit lower, maybe partly due to the low blood pressure at admission. And due to the low blood pressure compared to the other registry, so IV diuretic usage was a little bit less. However, IV inotrope use was pretty high, 31%. So also IV vasodilator use was less than the other registries. What about the device therapy in heart failure? Recently, ICD implantation is increased year by year. Also, CRT implantation is increased. However, compared to the other countries, so still we have a pretty low ICD or CRT implementation. Maybe the government regulation related to the medical cost is the most important factor, and the other reason is maybe the cultural background or education awareness and collaboration between cardiology specialists. So second part of the talk is I would like to introduce heart transplantation briefly in South Korea. So we have started heart transplantation in 1992. So first case, she is a 51-year-old female. She's still alive. And after Honors, Korean Network for Organ Sharing, heart transplantation is increasing very rapidly. So far, 908 cases, including multi-organ transplantation, heart transplantation was done. So this is the red one is the number of transplantation, and our waiting list is pretty high. But recently, brain death donor is also increasing. So maybe 1/4 of the brain death donor can provide the heart transplantation in South Korea. So one of the characteristics of donors and recipients recently is getting older, because the donor age is older people is increasing. Also, recipient is maybe recipient more than 60 years of age has increased up to 25 to 30%. So underlying etiology of cardiac transplantation was the dilated cardiomyopathy was the most frequent etiology, comprised 61% of the total transplantation. So what about the long-term result? This is the International Society for Heart and Lung Transplantation data. So 1-year mortality survival is 88, 5-year 74, 10-year survival is 55%. This is our data. So 1-year survival and the 5-year survival is almost similar. However, 10 and the 15-year survival rate is the 64 and the 56 is I think definitely better than the international registry data. One of the interesting findings in our heart transplantation patient, we found a pretty low incidence of cardiac allograft vasculopathy. So this is the red line is the international registry data. The Korean data has the pretty low incidence of cardiac allograft vasculopathy. I can summarize the characteristics of heart transplantation in South Korea. So patient is transplantation cases increasing. Donors and recipients are becoming older. Long-term survival is pretty good. Also, one of the interesting findings is the incidence of cardiac allograft vasculopathy is low. Finally, I briefly talk about the stem cell therapy for heart failure in South Korea. This is the Magic Cell program in Korea, which is initiated in my institution. Started 2003, so we used GCS effort to recruit stem cell from the bone marrow. Then we get the stem cell through the apheresis, and we infuse them into the impacted area. So we have reported at the Lancet 2004, so effect of intracoronary infusion of peripheral blood stem cells mobilized with the GCS on left ventricular systolic function. And recently we reported the long-term 5-year result showed 45% risk reduction in patients who received peripheral blood stem cells. So this is our Magic Cell program. So we have started in 2003 with the Magic Cell 1 program, and we have modified lots of. Then Magic Cell 5 program is the stem cell plus priming the patients with erythropoietin program. We got the Korean FDA approval, and we are doing the clinical trial now. So Magic Cell program, we can expect big cell program, stem cell transfusion or stem cell therapy tends to improve global left ventricle ejection fraction, also improve regional left ventricular contractility. We have proved the magic stem cell infusion reduces infarct volume and prevent left ventricular remodeling after acute myocardial infarction. We are doing another challenging program, including new cell sources for the stem cell therapy, such as iPS or embryonic stem cell derived mesenchymal stem cell therapy. So in summary, heart failure in South Korea is growing health problem also. And compared with the other regions, Korean heart failure patients is relatively young. The number of heart failure is almost half, and also low rate of hypertension and hypertensive heart failure. Blood pressure is lower than the other registry. Regarding the management of heart failure, low prescription rate of beta blockers and IV diuretics, high frequency of inotropic usage, and also infrequent use of the non-pharmacological treatment, including ICD or CRT. Heart transplantation in South Korea is well established. Also, innovative therapy using stem cell is progressing in South Korea. Thank you very much for your attention.